Multiple device placement for knee discomfort is easy and straightforward. The first device will go in the midline, the top portion of the knee, again, raised radial arrow pointing forward, and then again pointing towards your body. The first device is placed in the midline in this location. The second device location is placed lateral and medial, and again, to find the location, you can basically flex and extend the knee and feel with your fingers the joint space. This will be very obvious. The second device then is placed laterally with the raised radial arrow pointing up in this direction. Raised radial arrow pointing up. The third device is placed laterally, again at the level of the joint space, like so. A fourth device can then be placed in the lower leg in the midline, like so. This device placement has been helpful in patients that have chronic inflammatory processes giving rise to chronic knee discomfort.